Hello, my name is Darcy Miller. I'm the commissioner with the Orange County Department of Mental Health and Social Services. That is Orange County, New York. We are about 60 miles north of New York City and a population of just over 404,000. The age group of 0 to 21 is somewhere between 30 and 32% of our total population. And, we're pleased to be here to talk to you about our experience with system of care. So I get the benefit of being able to talk about the history of when we were funded initially and some of the thought that went into that, how we put a little bit of sustainability together to keep the efforts that we did under the system of care guidelines and values moving forward in our county. I've been in county government for 35 years. I've been in Orange County for 20 years. And I have to tell you, I work with some amazing partners. And that's really what our award from 2008 to 2013 helped to solidify. We went in with a proposal. You'll hear from Angela Turk in a little bit, but our Children's Service Division Director really led the charge in that. And the proposal was to provide services to ages 0 to 21. And we really wanted to target cross-system youth who were struggling with co-occurring diagnoses, who had social, emotional, behavioral challenges. We wanted to bring in our Department of Social Services and our Department of Probation. At the time, I was only with the Department of Mental Health, so that tight connection was so integral to us being successful with our system of care goals. And when we were funded, our technical support, which we appreciated throughout all those years of funding, said, you bit off way more than you can chew. You have to remove the 0 to 5 population, because at the time, the health department was very active with us as well. We were identifying early behavioral challenges in childcare and in pre-K, and we were concerned about how we were addressing the needs and or preventing the needs of those early ages. So together, we did eliminate that population, but did our intense work from 5 through 21 with some great successes. And the sustainability plan for us was really our Welcome Orange, which is our comprehensive, continuous, integrated system of care. So again, as a community that's challenged by doing it bigger and better, we brought our entire population in under that umbrella of shared values, shared mission and vision, and complexity expectation with a hopeful approach of providing services across all ages. And in the last year, we decided to pick up where we left off with the 0 to 5, because we know COVID has had an impact on all across our population, but in particularly with our 0 to 5. And I moved this part of the discussion over to Dr. Alicia Pointer, who will pick up from here.
I'm Dr. Alicia Pointer, and currently I'm Health Commissioner for Orange County, New York. Prior to this position as Health Commissioner, I was a pediatrician at a community health center. And over the past few years, I had many families of young children coming to me for help. They were struggling with their kids' behavior or moods. Many were concerned about development or their own parenting stresses. Some kids and their parents had experienced trauma, and families were worried about what impact that would have on their kids long term. As Darcy mentioned, COVID made this worse. Families were more isolated. Affordable, high-quality childcare was harder to find. And we had a shortage of staff in these developmental arenas like speech therapy or early intervention. A lot of people don't think about social and emotional health for our youngest kids, that 0 to 5 age range. But we know that if we support those kids and their families early on, that affects how they do in school. It impacts their family's stability and mental health, and it builds that foundation for the skills that they need to develop over the rest of their lives. Now, I know that. And as a pediatrician, as a doctor in the community for years, I had a lot of resources. I knew psychiatrists and therapists. I had a very good relationship with the team at mental health and lots of other community organizations. But even with that, even with those resources, a lot of times I just didn't know where to send those families. And if I felt that way, I can't imagine how the families felt. So I turned to Darcy and Angela and their team, and I asked, how can we help these families? What do we have in Orange County that we can use to support these parents and their very young kids?
Thank you. I'm Angela Turk. I'm the Director of Children's Services for the Department of Mental Health. And as a graduated community, we realized that instead of starting from scratch, we needed to begin by bringing together those stakeholders that Dr. Pointer just talked about. We realized that we do have services in Orange County, but they maybe are not coordinating care the way that we should be in order to help these children and families, have more success. So we brought together service providers, county departments, various not-for-profit agencies, schools addressing the needs of infants and early childhood and their families. And we looked at our current early childhood system of care to map out what existing resources we had and identified strengths, challenges, and needs. We also knew the value of reaching out for technical assistance as a graduated community. Um, we have learned so much from technical assistance partners throughout the nation for various populations. So we did it again. And we were fortunate enough to connect in with Michael Rivores and Monica Ruiz from Georgetown University Center for Child and Human Development, and with the National Center for Training and Technical Assistance on Child, Youth, and Family Mental Health. So they joined us in putting together an event. It was a full day planning event. And in addition to them, they invited Dr. Gina Sampson to the table. And Dr. Gina Sampson talked to us about the fostering, healing, and hope in early years. And it was an introduction to infant and early childhood mental health. And we asked her to do that so that we would get a sense of what a robust system of care would look like for infant and early childhood mental health. Following Dr. Sampson's presentation, Michael Rivores and Monica Ruiz provided an overview of NTAP and the components of a comprehensive system of care for early childhood. And then they engaged us, all of us that were present. There were approximately 20 stakeholders present at that training, at that planning event. It was both. And we had a conversation about how to leverage the success that we had with our system of care grant to meet the needs of now this population, the 0 to 5 population. The attendees and stakeholders were involved in a facilitated workshop that started with mapping, and then we moved to further identification of strengths, as I mentioned before, and then the challenges of our current system. Toward the end of the day, we were able to come out with a product where we had identified opportunities and some action steps that could be made to improve our current system and to strengthen the collaboration of our stakeholders. And I'll turn it over to Kristen, who will talk about some of the next steps.
Hi, I'm Kristen Fortuna, and I serve as co-chair of Orange County's Infant and Early Childhood Mental Health Coalition, as well as our Welcome Orange Training and Trauma Institute. The mapping and kickoff event that Angela talked about really planted seeds, and since then, those seeds have taken root in fertile soil. We've held 2 infant and early childhood coalition meetings, and we're committed to meeting quarterly. We know that it takes a village, so our meetings are interdisciplinary, pulling in those people that Dr. Pointer had talked about, and we continue to ask ourselves who else needs to be at the table. The meetings are hybrid, allowing people to attend in person or remotely. And since infant and early childhood mental health is relationship based, we really take time at each meeting to build connections, to share our resources, to share our trainings and events, to review our strengths, prioritize the opportunities for growth that were identified during the mapping session, as well as to identify and pin down those next steps for sprouting forward. Some of our county's strengths include our strong county leadership, our ability to successfully incorporate the system of care values and principles beyond our federal funding, the collaboration and commitment across agencies, and the willingness to explore creative funding to build capacity to serve those 0 to 5 and their families. Some of the priorities that we identified included building awareness around the importance of early social and emotional health, expanding provider capacity at the promotion, prevention, and intervention levels. Our community would like to see providers trained in evidence-based dyadic approaches, to have digital resources for caregivers to easily know what's available and how to access the services. Like many other communities, Orange County is faced with staffing shortages, with an increased need and an increased acuity. We need to do more with less, so collaboration and persistence are vital. We hope that this information will inspire you to collaboratively map out your community's existing resources and assets, highlighting areas of need and opportunities for partnership so that you can work together to center your focus and efforts on those who need it the most. When we invest in the relational health of our littlest ones, we can help build the foundation for lifelong well-being and positively impact the trajectory of a child's life.